Now, whenever we have a patient, after we have taken a detailed clinical history and examination, we have certain differentials in mind. For example, if we are suspecting osteoarthritis, then what we need to rule out hip joint pathologies as well as lumbar spine pathologies as well. So when we are going for radiological investigation in case of a hip joint, first we need to look at the hip joint in form of an X-ray, pelvis, AP view with both hip joints, which you can see it over here. This is a normal first X-ray. But if you see it over this, you cannot appreciate properly more of the lumbar spine. You can only appreciate some form of coccyx. Only the L5 and S1 vertebra is available. You cannot appreciate this L of the ilium as well. Therefore, when we are assessing these patients, as we need to rule out hip pathology, we also need to rule out the spinal pathologies as well. Therefore, we must have associated X-rays of pelvis as well as the lower lumbar spine, that is X-ray lumbosacral spine, AP and lateral view. All after we have done with this discussion. And once we are absolutely sure the problem with our examination is with hip joint, we can omit these lumbosacral X-rays completely as well. But that is if your clinical judgment is pointing out the problem is on the hip joint only. If you're suspecting that there may be a problem in hip joint or maybe in the lumbar spine, then you can go for radiological investigations of both as well. Whenever we get radiological investigations, we need to look at certain things. Now this is more focused view of the right hip joint and what we need to look for if we are suspecting osteoarthritis. First and foremost is always the joint space. What you need to look at is the joint space intact. If you clearly see it over here, if you see this joint space is somewhat preserved, it's lost somewhere over here, it's somewhat preserved, and you can appreciate there is almost reduced joint space. The first and foremost would always be decreased joint space in the femoroacetabular articulation. Then if you see more closely, you can appreciate there is an osteophyte formation. Now osteophyte can get formed over here in the posterior superior aspect of the femoral head. This could be at the posterior superior level of the acetabular wall as well, or it could be over here as well. Depending upon from where the weight bearing is actually going on, this can lead to osteophyte formation. Therefore, the first thing you look for is reduced joint space. The second is osteophyte formation. And then if you closely look, there is increased sclerosis of the subchondral bone. If you see this and this bone subchondral area, this is the posterior superior weight bearing area of the acetabular of the femoral head. There is increased lucency over here. You can appreciate a lot of the whiteness on this level. And once there's a lot of lucency, this whiteness is there, in between you can appreciate these black areas are lucencies. These are the subchondral cyst formation along with subchondral sclerosis. So what are the four things we have to look for is reduced joint space, osteophyte formation, subchondral sclerosis, and subchondral cyst formation. Now, if all these four are present, you can specifically label this patient to having osteoarthritis. But sometimes, for example, if you see this is normally the first and foremost X-ray you have to get, that is the X-ray AP view with both hip joints. That would show both hip joints, ischium, pubis, as well as the ilium, as well as the proximal, both femur. When you are viewing this X-ray, you have to just not only look at the hip joints, you have to look at other things as well. For example, if you see it over here, the cortex is okay. The patient can have an osteopenia as well, or the patient may have an associated osteoporosis as well. Bones may be weak. And then you have to look at problems specifically at the hip joint. Then again, you have to look for all those four things. They may or may not be present. For example, patient may have, if you see it on the right side, you can appreciate there is reduced joint space on the over here as well as deformed head. Although there is no subchondral sclerosis or cyst, but this deformed head suggests that there is osteoarthritis. Now, if you see it over here, there's definitely over here there is, as is initially Before the joint space becomes reduced, initially there's actually increase in the joint space due to inflammation, increased synovial fluid production, and that actually leads to increased joint space over here. But this is associated with deformity of the head as well. Eventually, subchondral sclerosis and all this may eventually develop, leading to classical presentation of osteoarthritis of the both hip joints. And if you're seeing at this X-ray, this may be associated with bilateral hip osteoarthritis.